Hi, and welcome to the 7th Annual Connected Health Summit. We are so pleased for you to join us virtually this week and excited about the next few days of sessions focused on consumer innovation and engagement in connected health. I hope you're familiar with Parks Associates Research. We are a market research and consulting company focused in on the consumer technology markets. For the past 10 years, we've looked at the connected health solutions in the home and specifically at the opportunity to serve consumers with technology. Each year, Parks Associates produces over 100 syndicated research reports and provides research and consulting services to over 500 companies. My name is Elizabeth Parks, and I'm the president of Parks Associates, and we're so excited to welcome you. In addition to the Connected Health Summit, Parks Associates also hosts 6 executive conferences: our Connections Community, Smart Energy Summit, Future of Video, and the Connections Summit at CES. I'd like to start by thanking our event sponsors, Alarm.com, Nortec Security and Control, Athena Health, Softtech, Beckler, and Sprosty Network. In addition, we'd like to thank our event supporters who help share information about our conference topics and speakers. A huge shout out to Parks Associates Advisory Board this year, who helped shape the content of this conference and spent their valuable time and support providing us insight into the topics we should cover. Throughout the next few days, we'll look at key questions surrounding the health market, including the impact of COVID, consumer attitudes towards new health solutions, shifts in consumer behaviors, and serving seniors and caregivers at home. Today's morning sessions will focus on transforming the healthcare ecosystem. In the afternoon, we'll address telehealth and remote patient monitoring, featuring Dr. Donna O'Shea from United Healthcare. Tomorrow morning, we'll look at seniors and caregiving, and in the afternoon, focus on home services and the in-home care experience. On Thursday, we'll highlight health tracking and the impact of COVID on consumers. And last but not least, on Thursday afternoon, we'll hear about the future of healthcare and technology innovations. Thank you for joining us, and in just a minute, you will be hearing from Dr. Jennifer Kent on the consumer state of mind. In between sessions, we hope you will mingle on Swap Card and visit our sponsors. Thank you for joining us today.
Thank you so much, Elizabeth, for that introduction. I am so pleased to be kicking off our 7th annual Connected Health Summit. It feels a little differently this year. I will very much miss sitting and talking and discussing with a lot of you in person, but we have a lot of great ways for you all to participate virtually. We really could not have moved these in-person events to a virtual method without our sponsors. We are so very grateful that they've come along with us for this transition to keep these conversations going. There has never been more to discuss than there is this year in the connected health space. As Elizabeth mentioned, we will be talking in this morning's session about the impact of COVID-19 on the healthcare ecosystem and what that means for the connected health space. I'll be talking a little bit this morning about the impact on various parts of the ecosystem, and most importantly, the consumer and where the consumer is at and their state of mind. We'll hear from a visionary speaker on how COVID has changed telehealth and the future of care delivery, and there will be time for question and answers with her. And then we'll have a panel discussion and bring in several industry speakers to talk about market transformation and outlook for this connected health space. Following that, there will be breakout networking discussions, and we really want to hear from you and your perspectives. There's 2 separate chat rooms. One will focus on the impact of COVID-19, the consumer perspective. We want to hear from you in your delivery of care and your interaction with your customers. How are consumer changes needs changing? And how are you addressing those needs? And then also from the provider perspective, what new trends are you seeing there? We want to hear from you. We want to have some really great, rich conversations. Throughout the day, please pay attention to the sidebar on the right. So if you were here a little early, you saw a little instructional video. There's a sidebar on the right where you will see a chat, a question, and a polling tab. So in the questions tab, you're free to submit questions to any of the speakers, and we'll be taking those throughout the day. There's also the ability to upvote questions. So you can say some of the best questions, the questions that are relevant to most of our attendees will rise to the top. So please, if you have a question for the speakers, put it in the questions tab. There are also polls in the polling tab. We want to understand your perspective and poll the state of the crowd on some important conversations, and we'll get into the polling results later in the panel discussion. And finally, that chat tab is a little bit more free form. You're welcome to put your thoughts into that chat tab, but also look for notes from our team. So for instance, when we're ready to go to the networking discussions, it can be a little bit difficult to find the networking discussion link in the swap card platform. So our team will, when it's time to go to the networking discussions, our team will put the links to those networking discussions right in the chat box. So it's easy for you to hack that and get over to the networking discussions. So to kick off this morning, we want to take some time to take stock of where we are and what this year has really meant to consumers and to players across the larger health ecosystem. Going into 2020, Connected Solutions were making progress. From the first Connected Health Summit 7 years ago to today, much of the technology foundation had been laid to build solutions and services on top that would close the gap between the facility and the home, to empower consumers with apps and insights and devices they could use to manage their health and wellness. We've seen a lot of innovation from vendors, a lot of healthcare providers and health systems trialing approaches to make connected care work in their models, and a start on consumer education about the value of connected health products. Yet I think all of us in the connected health space would admit that before 2020, connected health to the home or in the home was absolutely at the periphery of what we considered to be healthcare. We've also used the term patient-centric care a lot over the past 5 years or so, but too often patient-centric operationally still means facility-centric. It's thinking of people as patients and not as people in their wider lives and needs outside of the facility. COVID-19 is a sea change no matter where you sit in the ecosystem, provider, payer, vendor, consumer. A new mindset is starting to take hold where the home is a viable and valid location for health management and healthcare delivery. And in reality, the home is the place where most of healthcare considered broadly actually takes place. Considering what we eat, whether we exercise, whether we are taking our prescriptions as prescribed, or how we interpret those discharge instructions if we did need to seek care in a facility. Home can now be the place where acute care consultations can be received virtually. Chronic care management can happen in an ongoing way. It's also a place where many of us may continue to work long-term, right? When we think of health broadly and include fitness, diet, acute and ongoing care, caring for our mental health and the mental health of our children, caring for our elderly loved ones and helping them to live independently and safely and well in their own home if possible, you see the value in a new mindset about what home-centric care can mean. In talking with many industry leaders over the past 6 months, a consensus has emerged that the connected health market has been accelerated a good 5 years ahead of where it would be without the pandemic circumstances. We've moved 5 years ahead in just a matter of months. The COVID-19 crisis has pushed on all parts of the ecosystem to expand our thinking about connected health and has really broken connected health out of its box to the point where the idea of home-centric care can be a valid and maybe even preferable care model in some situations. So let's look from a high level on the impact of the pandemic on the various parts of this ecosystem. So let's start on the front lines. Those of you in health systems, working in hospitals, physician practices, care providers yourselves, the first impact, of course, was and continues to be adjusting protocols to address the virus itself, from testing, triaging, treating patients with COVID-19, and dealing with limitations to personal protective equipment, PPE, and new workflows to protect providers and minimize spread. The impact of COVID-19 has been systemic, touching everyone, but also very, very uneven. There's hot spots, there's surges and dips in different parts of the country at different times. There's parts of a health system that are really slammed and having major personnel shortage issues, and other parts of a health system or other types of care practices that are almost shut down and laying people off or turning to furloughs because the volume isn't there. We know the volume has been way down from limitations on non-essential services, sometimes by government mandate or system or practice leadership, other times due to reticence from consumers, consumers being hesitant to seek non-emergency care right now. As a result, the American Hospital Association projects $323 billion in revenue losses for 2020 alone. So out of necessity to reach patients, to keep volume up, to test potential COVID-19 patients in the parking lot, right? Providers have turned to connected health tools, scaled existing virtual care operations that may have been relatively small or compartmentalized or sectioned off into a specific department, right? And introduced previously reluctant providers to virtual care delivery. Recent reimbursement changes have made this reliance on virtual care possible. So CMS, the Centers for Medicare and Medicaid Services, of course, has been the real leader here in the past 12 months. Let's look at all of the changes that have been made. And some of this was happening towards the end of 2019 or early 2020, even before the pandemic really hit here in the United States. And then some of it was opened up once the pandemic started to take hold. But CMS now reimburses for virtual check-ins for chronic care management. It's made possible reimbursement for remote patient monitoring provided by third parties, so not having to be provided specifically by a care provider, but under the general supervision of a provider, allowing third-party vendors to come in and provide reimbursable remote patient monitoring, which is really important to be able to scale those types of services. Expanded provider types offering telehealth, so more providers from different academias, different departments able to offer telehealth and be reimbursed for it. Suspending origination site limitations, those regulations and policies around where a consumer must live or what type of facility they must visit in order for a telehealth service to be reimbursed. Reimbursement for behavioral health for the first time, and expansions there, very important, especially in the middle of a pandemic. And then payment parity with in-person care. And the commercial side has followed CMS's lead in many ways, expanding coverage for telehealth and making major investments in member education about their telehealth options, about their coverage for telehealth, how and where members can access virtual consultation services. And to be honest, reimbursement has been among the top barriers holding the virtual care market back. The technology has been available and in place for years, but lack of clear, sustainable business models has limited its potential. So while many of these measures are legally temporary, there's reason for optimism that many of these changes will become permanent. And interestingly, COVID-19 has widely been reported as a boon to commercial payers' bottom lines. So that avoidance of routine care has saved payers billions and more than offset additional costs from testing for and treating COVID-19, at least in the short term. So it will be interesting to see whether or not that results in new investments in different ways of operating or greenlighting new programs around virtual care initiatives. Now, vendors across the connected health ecosystem have surely felt and are responding to this boom, of course, this expanding demand. Vendors across the ecosystem report dramatic and rapid operational scaling to keep up with demand. The CARES Act contained $200 million of funding for telehealth to support the expanded use of these tools. American Well, a leading telehealth platform you may be familiar with, reported 1,000% increase in virtual visits due to COVID-19. Behavioral and mental health virtual counseling service Talkspace's new user count nearly doubled between mid-March and May 1st of 2020, compared with that same period in 2019. TytoCare, a solution that blends both telehealth services and connected medical device peripherals to detect and transmit vital sign data. TytoCare surpassed all of its 2019 revenue in the first few months of 2020, and I know that they were watching what was happening internationally to plan for and scale their operations here in the United States. And this growth is happening not just in the telehealth space. Gyms, fitness centers were shut down across the country, forcing many small fitness businesses online, and also encouraging consumers to trial new online fitness services. Beachbody, for instance, provider of the popular Beachbody on-demand online fitness service, reported 300% subscriber growth between March and May 2020. And lastly, we cannot forget the tech giants. So in the past 5 years or so, we have seen Amazon, Google, Apple, not to mention other giants like Samsung and Microsoft, developing their healthcare strategies. And don't expect the COVID-19 crisis to discourage their efforts. The ability for the tech giants to impact this space is really hard to overstate. They have enormous user bases. Amazon counts over 100 million Prime members, for instance. Google counts over 120 million Android users in the United States. Apple counts over 100 million iPhone users in the United States. They have the ability to scale, the ability to cut out middlemen. They already have a footprint in the home in many ways, not the least of which being through voice assistant and smart speakers. All three of these companies have consumer-facing wellness and fitness hardware, specifically wearables. So for instance, Apple, of course, is the Apple Watch. Google is in the middle of an acquisition of Fitbit, one of the leading wearables in the market. And Amazon, in just the past week, announced its big wearable play called Halo. So all three of them in the consumer-facing wellness fitness hardware market. All three also, of course, have distinct software and services strategy. Amazon focusing on pharmacy services, prescription delivery, focusing on cloud services with its AWS assets, and even telehealth services. Amazon does have its Amazon Care program, which is a telehealth service for its employees in the Seattle area. Google focusing on AI, of course, with its traditional, background, artificial intelligence, machine learning, data analytics. Apple providing the software platforms to enable the next killer consumer research and healthcare applications. And of course, specifically related to this pandemic, Apple and Google work together to develop an API and framework that developers, in partnership with public health officials and other stakeholders, can use to build contact tracing apps to detect and hopefully manage the spread of COVID-19. So where's the consumer's head at? Consumers are first and foremost dealing with the pandemic itself, and it's becoming more personal to a larger percentage of the population as time wears on. So in March of 2020, just 8% of consumers in US broadband households, so US households with broadband internet, who's the focus of our study here, personally knew of someone who had COVID-19. And by July, that had risen to 39% of the population, of that population. In response, life has changed for just about everyone. 93% of consumers in US broadband households report a change in lifestyle in response to the pandemic. most commonly sheltering in place or social distancing, avoiding large crowds, and taking other precautions. Work has also changed for consumers. This is really, really important to understand where the consumer's mindset is at. As of July 2020, 35% of broadband households had at least one member working remotely. That brings drastically new behaviors, new stresses, new household dynamics. But for many, the changes have been even more severe. So 1 in 4 report a member of their household had a decrease in their working hours. 17% said a member of their household had a salary or wage cut. 16% report a member of the household being laid off, and another 14% report a household member being furloughed. And note that in the United States, much of our insurance coverage is employer provided. And so for many who lost their jobs, they also lost their health insurance in the middle of a pandemic. Under these circumstances, much of life has shifted online: work, school, shopping, though many of us may have been more prepared for shifting our shopping online, but communication as well, right? With massive uptake of video conferencing solutions, but also healthcare. Under the circumstances, so in 1 year, we saw telehealth service use nearly triple. So last year, Q2 of 2019, 15% of US broadband households reported using a telehealth service in the 12 months prior to the survey. So this year, as of May 2020, that number had risen to 41%. When I talked about the market being accelerated at least 5 years ahead in just a matter of months, this is one of the places that shows up. This is incredible growth for consumer use of a new service type. And of course, that jump was driven by necessity. In 2020, the number one reason consumers chose to use a virtual care service was due to limited access to their doctors or health services by traditional means. This shifting of drivers is really interesting. In all the years we've been testing this, the number one reason people had used a virtual care service was convenience. Wanting to see a doctor after hours, wanting to see a doctor on weekends, or just reporting that virtual consultations were more convenient generally. The second driver has traditionally been self-triage. That is, wanting to see if whatever the issue is requires elevated care. Should I make a in-person doctor's appointment? Should I go to an urgent care facility? Should I go to the ER? Finally, in the past, the third driver has often been a sense among consumers for some conditions that virtual care is preferred because it feels more private or more anonymous. And there are certain types of conditions or care that's sought, or certain types of consumer segments who feel that way about virtual care. But overall, we continued year after year to see a pretty strong bias in favor of in-person care, an assumption that in-person care means better quality of care and that one should seek in-person care, right? This year, for the first time, we see a powerful motivator in the opposite direction: avoidance of facilities. So staying home, being treated at home means avoiding potential exposure or avoiding exposing others if you're there in person. This may be a really powerful new value proposition to build upon for the future of connected health. What does avoiding exposure mean? Proactive screenings at home. We're seeing that happen as a requirement among many employers right now, as well as even schools, that you have to proactively take your temperature before you even come to school. What does avoiding exposing others mean? Monitored care at home. Both of these scenarios for many conditions will require more than phone calls and video chats, but data to detect, inform, and assist in diagnosis. Speaking of which, devices are very much a missing element in most virtual consultations today. We know that in a facility, in an office setting, medical devices detecting vital signs are a critical foundational component of a workup. But connected medical devices are simply not widely available for consumers and consumer homes today. Now, there's distinct remote patient monitoring programs for certain chronic conditions, for cardiac diagnostics, for instance, for some post-discharge monitoring programs to try and reduce hospital readmissions. And all of these do utilize devices to enrich that connected care at home, and likely will pave the path for the rest of the market here. But little headway has really been made in looping in other types of devices, especially consumer-acquired devices that are already in the home, weight scales, blood pressure cuffs, even wearables data, into the virtual consultation. Device data is very often siloed and out of the loop. The concept of sharing data from medical devices and from data stored in consumers' health and wellness apps is appealing to just about half of all consumers. And this rises to over 60% among those who do own a connected health or wellness device at home. So we expect this to be a very likely area of new innovation from vendors over the next few years. Thinking about other ways consumers are trying to manage their health and that of their loved ones at home, the need for new services and solutions that serve the oldest among us has really been highlighted by this crisis. We know that seniors are at a higher risk of poor outcomes if they contract COVID-19. And social distancing recommendations for seniors have been amongst the most strict. Family caregivers are searching for solutions that can help. So in our recent research, we see that 9% of caregivers, who make up about 20% of all US broadband households, self-identify as a caregiver or sort of an expectant caregiver. 9% report arranging for or purchasing a communication solution for an aging loved one to be able to stay in touch with them, and 30% have considered it. 7% have arranged for or purchased a health or wellness monitoring solution for an aging loved one, and another 32% are looking into it. And concern about virus spread in senior living facilities is also weighing on caregivers' minds. Many caregivers report considering removing loved ones from a senior living facility or delaying a move to a senior living facility in favor of keeping their loved one at home. What our consumer data tells us is that consumers are making changes and they are looking for new solutions to help them manage their new reality. When asked, what lasting changes do you expect to make to your lifestyle or household behaviors from your experience with the COVID-19 crisis, right? 45% plan to continue cooking more at home. 44% plan to continue to avoid large gatherings of people. 39% plan to take better care of their health and wellness. 30% are looking for new ways to exercise from home more often, and 1 in 5 want new ways to connect with friends remotely and stay in touch with the people they love. And what's interesting is that all of these plans, these feelings that these are the changes that are going to last for consumers, all of these have risen as the pandemic wears on. So they haven't decreased, they haven't receded, right? So we've seen increases across the board that these will likely be lasting changes for people tested in May and tested again in July. So over the next 3 days, we will be diving much more deeply into many of these threads. Certainly the impact of COVID-19 on healthcare, there's so much to dive into here. We have so many great speakers to really tease out the impact that they're seeing on the people that they serve, on their organizations, and how they're dealing with that. Virtual care, again, the idea that it's moving from this periphery of healthcare to a core seat at the table of healthcare delivery. New needs for seniors and caregivers in particular. What has changed? How can we serve them differently and better? How can we reach them? Partnerships for connected health at home. There is an enormous number of companies that are already serving consumers at home that have vast expertise on how to reach consumers, how to get them connected, how to educate them on the use of technology in the home. And there's lots of areas that are ripe for partnership, specifically in the connected health space. We'll talk about the role of data, how we can enrich virtual care and empower consumers more with better insights, while also protecting the privacy and security of that personal health data especially once it's out of the realm of a lockdown, let's say, lockdown IT type environment for health at a facility. And finally, what is the future of connected health? This is the big question, of course. What changes that we see today will last? Which will recede? What can we build upon? And we have a great lineup of speakers to get into these questions. So with that, I'm going to remind you, please, if you have any questions for our speakers, please look over to the questions tab where you can submit your questions. And we're going to take just a moment to switch to our Visionary Insight speaker, Tori Ames, who is the manager for Cincy Kids Health Connect, the Center for Telehealth at Cincinnati Children's. So give us just a moment and we'll bring Tori on to talk to us today about what she's seeing in the telehealth space. Okay, hi, welcome back. We're so excited to bring you some great insights from Tori Ames from Cincinnati Children's, who will be talking to us today about how COVID has changed telehealth and the future of care delivery. Tori, we'd love to hear from you. Go ahead and take it from here. How are you?
I'm great. How are you? Good morning.
Good morning.
All right. As Jennifer said, my name is Tori Ames. I work at the Center for Telehealth at Cincinnati Children's, and I'm going to speak to you today about how COVID changed telehealth and the future of care delivery. So a little bit about Cincinnati Children's. Our vision is to be the leader in improving child health. And if you look closely at our mission, you'll see that transforming the delivery of care is absolutely part of our DNA. And I believe that's why we've had so much support of telehealth at our leadership level long before COVID hit. The other thing that's great about being a pediatric hospital is that even if you don't like my content, you'll get lots of cute pictures of cute kids throughout the presentation. In all seriousness, we're the #3 children's hospital in the country, as ranked by US News and World Report. We're also an interesting hospital because we're the only pediatric hospital in our service area, but we also see patients in all 50 states and in 58 countries. So we're both a community hospital and a destination hospital. Our big news for next year is that we're also opening a new critical care building, and yes, it will be outfitted with telehealth. At the Center for Telehealth, we've been open for about 6 years. We started as that very traditional hub and spoke model. Over time, we've added other services like remote patient monitoring, consultations, Project Echo, and direct-to-consumer. We think that we're going to continue to grow and look and add other services long before COVID, and we have a strong foundation for telehealth at Cincinnati Children's. So today's objectives are to compare telehealth before and during COVID, discuss the current state of recovery. And that's really what we're calling this period right now, is recovery, as patients are coming back into the hospital and we're still seeing them via telehealth. And then also provide some insights into the future of telehealth. In other words, everything shut down at the end of March in Ohio. We had to quickly pivot and figure out what in the world we were going to do to see our patients. What happened, what's going on now, and where is telehealth going? Before I get started, I want to mention that there's not a single thing we don't do at Cincinnati Children's from the lens of patient safety and clinical outcomes. And even in those moments of chaos during COVID, we still looked at everything that we did through these two lenses. And I hope that you'll see those themes as we move forward. Okay, so how many of you all felt like this image that I have on my screen? This is absolutely how I felt as COVID hit at the end of March here in Ohio and when things shut down. I feel like this image may have been me. There's probably not a single person who isn't watching this that didn't have to work around the clock, come up with new and innovative ways to meet patients' needs, to pivot and do it almost immediately. And I'm going to talk a little bit about how that happened at Cincinnati Children's. But first, I want to give you some perspective so that you can understand what happened with telehealth before COVID hit, so you can understand what those big changes were. So if a division contacted us to do a telehealth program, they would fill out a division request form. And if it was something that was a workflow we had done before, it was an existing use case, there was already an EMR build, then we considered this basic. It would be approved and assigned to someone in telehealth to get the division up and running. But if it was something a little more complex, we had never done it before, it was a new use case, a new workflow, there had to be an EMR build, we considered it more complex. So this is what would happen. We would collect the data, review metrics, determine feasibility, review the financials, have divisional meetings, have the division and telehealth sign a charter so we were all on the same page. We would develop a workflow, we would do a technology review, we would train everyone that was part of that workflow so that we could do some mock patients. And once we determined that everything would work, we went to our telehealth steering team, which is made up of senior leadership. They would approve and give their blessing. We then launched the project, and then we would do on-site support. So we would actually sit with the provider for their first 3 or 4 visits to make sure that they were comfortable and the patients were having a good experience. Then we would stay with that project for 6 months to a year, doing some quality improvement work. At that point, after a year, we would turn everything over to the division and they would manage the telehealth project themselves, and we would still stay in touch with them. During this time, our volume was growing steadily. We had about a 30 to 40% growth over time, and we felt good about that, especially for the size of our operational and tech teams. And then our patient satisfaction was also high. So we do survey all of our patients who do telehealth visits, and we were typically rated a 9 out of 10. We use that information to do quality improvement on our workflow, provider training, etc. We'd also done a lot of work around provider satisfaction. And what we learned during that time is that typically, if the patients were safe and the patients were satisfied, we had provider satisfaction and adoption. So if the provider could determine that the clinical outcomes could be the same or better as an in-person visit with telehealth, and if the patient was happy with the experience, then providers were usually on board. Now, there are a few additional pieces underneath that, such as, will it take more time? Will I be reimbursed? What about productivity? But in general, we had some strong provider satisfaction as well. So we're moving along, we're feeling good about our team, and then coronavirus hit. As I said, things closed down in late March. The landscape of telehealth completely changed. So if you start at the bottom of this slide with patients, that's really where this begins. We moved from patient interest. So what we would do to see a patient in the home is we had some very specific use cases with providers, and we would offer telehealth to the patient for follow-up care. If they were interested, we would move forward with telehealth. That completely changed during COVID, because if you wanted to see your provider, you had to be willing to do a telehealth visit. Now, I would say in general, patients were very interested in telehealth, but it was definitely a shift because the provider adoption also had to grow exponentially. It was no longer voluntary for the provider. It was something that they absolutely had to do. We also had rapid development of technology. And I'm going to talk a little bit more about our technology a little later, But the software that we used most during COVID and the software that we are using most now is one that we had never used before COVID hit. So that was an interesting development for us. There was also some temporary expansion of payer policies that we absolutely had to stay on top of. We're a pediatric hospital. We accept a lot of Medicaid. We're dependent on Medicaid, and that's done at the state level. So we had to stay on top of those things, in addition to the CARES Act and other policies that were changing. And then licensure was a huge piece for us. Typically, our providers have been licensed in Ohio, and then in our service area, they may have been licensed in Kentucky and Indiana. And as you know, you have to be licensed in the state that the patient is located in at the time of service. We hadn't really done a lot of licensing outside of that primary and secondary service area, simply because we didn't have the patient volume in many states. For most use cases, there were some unique things. But this completely changed with having patients in all 50 states and in 58 countries. Now, thank goodness so many of the states had that temporary licensure that was available, but it was absolutely a huge lift, and it was a big shift for us as well. Our volumes, as you can see, were reflected in this. So we're moving right along. Things are going well. We're seeing about 150 to 300 patients a month. And then the end of March hit, and we saw 4,900 patients. In April, we saw 25,000 patients. And then in May, we saw a high of 29,000 patients. We did this with the same size telehealth operational team and tech team. So as you can imagine, the way that the hospital came together to make this happen was absolutely unbelievable. Now, our volumes for telehealth have gone down a little bit as we have in-person care coming back. I looked, we had just over 20,000 visits for July, but what we're hearing from our administration, from providers, and also from our telehealth perspective is that telehealth is absolutely not going away as we look beyond COVID. May come as a surprise to you, but we no longer had time to do this complex, very thorough launch of telehealth, and we had to move to something different. So within a few days, we had to come up with a completely different process, and it was pretty unbelievable. The way that this worked is that either a division director or a business director would fill out a form. It would go to our chief of staff's office and then come to telehealth, where someone from the telehealth team was assigned to manage that team and get them up and running on telehealth as quickly and safely as possible. And it didn't matter what your job was before in telehealth, you were reallocated to work on making this happen. So for instance, we have 2 people that work just on Project Echo, which is a project that doesn't see patients. It's about provider education. They were redeployed. I manage our direct-to-consumer. I was also redeployed. But these are the types of things that had to happen in order to make this be available for our patients. So during that time, we've onboarded and created telehealth accounts for more than 1,000 providers. I think we did about 900 providers in around 2 weeks. It was unbelievable. We also implemented more than 60 new telehealth programs. So there were some divisions that had done some telehealth. They had a few providers and some use cases where they had used telehealth before. So because we use a global visit type in our EMR, we were able to quickly roll out the EMR for those divisions. But we had more than 25 divisions where they had never done telehealth before. So we had to have more than 25 new EMR builds, which was pretty unbelievable. And we have an Epic team, and they worked round the clock to make that happen. Our training was also a huge lift. We have one training specialist, and she typically had done things one-on-one. That could no longer happen during COVID. We had to shift to doing group trainings and also training modules. And when I review the number of softwares that we use, you'll understand why this was such a huge lift. We also had multiple new use cases emerge. A great example is a multidisciplinary clinic. What do you do when one patient sees 6 or maybe 8 providers in one visit? Coordinating that from the providers' homes is pretty unbelievable. The workflow, the software that's used, the hardware that the providers are using, this is something that we had to deal with and to figure out. And there are multiple examples of this. I mentioned the temporary licenses. This was a big lift by med staff and telehealth and really a lot of the divisions too, and our patient services team for our nurse practitioners and other PAs and other providers. And it really wasn't just telehealth. I mean, I have here something about the coding model. I mean, the coding model had to be updated so quickly as those payer expansions were happening so that we can ensure that everything was happening correctly on the billing end. It was truly unbelievable that everyone in the medical center came together to make this happen. And some of this had to happen within days, within weeks. And we're still adding and making changes as we move forward and the months go by and things are starting to settle down. But it was a pretty unbelievable time in the medical center to make this happen for our patients. We're not alone. I mentioned this earlier. If you work in the health field, Jennifer mentioned this, everyone was innovating and, and trying to organize the chaos and make sense of what was happening so that patients could be seen by their providers and patients could get the care that they needed. I think that many of us have accepted that it's happened. And it's funny because I went through these slides a little bit earlier today. And when I got to this slide and I saw acceptance, I took a deep breath because during that time in COVID, it was so stressful and we were all working that now we have to accept that COVID happened. We have to go back, we have to figure out what the journey is and how we move forward. And I'm going to talk a little bit about that. And again, this is what we're calling our state of recovery. Okay, so I'm going to be really honest. Things have changed for the telehealth team internally. We have been rolled out the red carpet, and telehealth has become a huge spotlight in the medical center, and it's not just here, right? It's everywhere. It's been interesting when I make a phone call in the past, it was like, okay, Tori, sounds great. Now I say I'm with telehealth, and it's like, oh my gosh, thank you for what you did. Again, it wasn't just about telehealth, but it's been pretty interesting inside the medical center to see a little bit of that change happen. But in all seriousness, there are three main points I want to make during recovery. I was on a call, gosh, I guess it's been a few months ago at this point, and it was with Jefferson University. And we were talking and they made a point, and I think it's absolutely true. Telehealth no longer just belongs to the Center for Telehealth at Cincinnati Children's, and it's not just at our hospital. And what I mean by that is, in the past, and I can hear myself saying it in this tone, if everyone would realize that telehealth is not just this cool thing to do, but it's actually a delivery of care model, we could finally scale telehealth and make healthcare accessible for all patients. The problem is that it did become just a delivery of care model inside the medical center. And so now we have thousands of people who have used telehealth, who have been part of developing these workflows, who have ownership and expertise in telehealth in ways they had never had before. There are so many new suggestions and opinions and experiences that can be attributed to telehealth, and how we wrangle that and put that all together as we move forward so that it's the best experience for our patients, we get the best clinical outcomes, and it's truly quality care is going to be really important as we move forward. The telehealth team, me personally, I also had to learn to release some of that ownership, and that's okay. I didn't have to manage all of those pieces anymore. But as telehealth is becoming a delivery of care model and not just something cool that you do, I'm sure this is happening in other hospitals as well. It's really releasing that ownership so that it's spread throughout the hospital. This brings me to my next point, and that's that we're going back and we're looking at the workflows and the processes and the technology that was implemented during COVID. I mean, it was, again, pretty unbelievable. We're actually going and meeting with each division. We're scheduling meetings for whoever their telehealth person is to sit down and review these things with them to see how things are working, what improvements can be made so that we're all back to a baseline. We're also doing some retraining of our providers, especially for those who had never used telehealth before, to make sure that we're all on the same page because things were changing rapidly in the medical center. It wasn't just every week there was new information. There was new information every single day as we move forward, and we all had to stay on top of all of that information rushing in, organizing it, and making sure that it made sense for our workflow and our processes. And then this brings me to the next point. In the past, we may have talked to a provider and a division director and said, oh, look at this literature. Can you believe this is amazing? This is similar to your use case, and it's working really well. This use case is being done at another hospital. And sometimes the provider would say, oh, that's great. Let's try it. Let's move forward. But sometimes the provider would say, yes, I see that. It makes sense, but I don't think it's right for my patients. Well, that's not happening anymore. Providers have used telehealth and patients have used telehealth in ways and more often than they ever have before. We know that we can do more telehealth. And so the providers, the division directors, our administrators, we're all thinking about what is the right in-person virtual visit mix for each division. Now, for us, it may be something like 25% of all ambulatory visits should be virtual. Now, I don't think it can be cookie cutter for each division, and it would probably be a tiered approach. But hospitals are really starting to think about and defining what that virtual mix and in-person should be. There are always areas of concern as well as you're rapidly scaling. I think clinical outcomes is a no-brainer, as is patient and family experience, but also employee experience. And provider experience is part of that, but there were also so many other people that were part of this rapid scale. The schedulers, the registration team, legal, not to mention legal, nurses, and we have to be able to reach out to all of those individuals, understand their experience, and learn from them so that as we're looking at our processes, our workflows, et cetera, we have the best product and service available for patients. And then I think as you're thinking about telehealth, you're always going to be talking about value. And that's really where the patient and family experience, the provider experience, the employee experience, clinical outcomes, and the financials all come together. Are patients still feeling the value of telehealth? Does telehealth still make sense? I don't think we'll ever stop evaluating value for telehealth. I want to touch a little bit more on patient satisfaction. Our patient satisfaction is still high. We started working with patient and family relations just before COVID hit, and we're tracking telehealth visits versus in-person visits and patient experience for every division. And I will say that they're pretty much tracking the same. I was surprised by that. Some divisions are a little higher in telehealth, some are a little higher in person, but they very much track the same. But it doesn't mean that we still don't have some pain points. And here's my example. We had so many phone calls coming in during COVID from providers and patients for troubleshooting that we had to add 3 permanent full-time positions to be able to answer our phones. So we went from 2 people answering the phones to 5 people answering the phones. And those new positions are permanent because we're going to be moving forward and we're going to keep using telehealth. It's not going to diminish within our hospital. But I talked with a few of those individuals and they boiled this down in patient calls to 3 things. I didn't receive the text or email, the technology didn't work, and the provider was late. I think all of us as hospital, providers, administrators, partners, vendors, we have to figure out how we're going to address this because it's not going away as telehealth grows. I mean, the provider is late. Is there a way for the provider to push a button and the patient knows that they're running late? Is there some sort of engagement that can happen in the waiting room with a chatbot or AI or some data collection? I'm not sure what the answer is, but these pain points are not going away. And as patients are now using telehealth, consumerism is at the top of all of our minds. We're going to have to address these areas of trouble. I mentioned our technology a little bit earlier. So these are the technologies that we typically use for telehealth at Cincinnati Children's. We had never used Microsoft Teams before COVID hit, but we realized that we had to scale something rapidly. We had to figure something out. And what we realized is that the hospital had an enterprise license for Microsoft Teams. Other hospitals were using it for telehealth successfully, and it was HIPAA compliant. So our tech team very quickly and very thoroughly completely evaluated Microsoft Teams with our operational team and with some of our clinical teams, and we rolled this out throughout the hospital. During COVID, this is the #1 software that we used, and as of right now, as we look forward, it is the software that we're using in this moment the most. But the reason that I put up all of these softwares is that for the provider experience, it is different for every one of these softwares. And for the patient experience, it is different for every one of these softwares. In fact, for a provider, if in the morning I'm seeing a patient at another hospital, I might be using Cisco Jabber and Extended Care. But then later, if I'm seeing a patient in the home for follow-up, I might be using Microsoft Teams or maybe Teladoc. And now we've just gotten an FCC grant where we're integrating TytoCare into our Teladoc platform, which is white labeled as Cincy Kids Health Connect. But each of those experiences is different. And I think that as we move forward, we're going to have to figure out how that provider and the patient experience can be more standard. How are these softwares and these pieces going to work together? How are they working with Epic, which is our EMR? How are they working with our intranet? We got to figure out this interoperability piece because technology has grown rapidly. Our next step is to figure out how all of those pieces fit together. Okay, that brings me to where telehealth is going. Oh my gosh, that's a lot of trends. It's probably too many trends to put on a slide. But my point with this is that we were talking about many of these things, actually most of them, before COVID hit. And that's what we're going to be talking about, in my opinion, beyond COVID. Consumerism, chronic care management, knowledge sharing, these are the conversations we were having before, and these are the conversations that we're still having now. The big difference is that there are more people at the table with more experiences, more suggestions, opinions, and improvements. The pie of advocates and champions for telehealth has grown. Now, I think that some of these trends are going to be prioritized a little bit differently as we move forward. I think some of the themes underneath them may change, but we're still going to be looking at many of these trends. A great example is use case expansion. I talked about that multidisciplinary clinic. Before COVID hit, I was talking about moving into asynchronous, doing consumerism, and chronic care management. After COVID, I'm still talking about those three things, but those other use cases have emerged, like the multidisciplinary clinic, where what if the patient comes in person and they see the plastic surgeon in person, but the provider for speech therapy is remote because we want to limit the number of people in the room with the patient. We think we figured that out now, but we didn't have the software or the hardware or the workflow set up for that before COVID, but that use case is not going away. And that brings me to the left side of the screen and that interoperability piece. And I touched on this a little bit earlier. How are we going to make all of these pieces fit together? Because that's where I think telehealth is going. I think it's not so much about telehealth anymore. I think telehealth is one small piece in the patient's overall digital pathway. I gave a talk a few years ago about telehealth being the virtual front door for patients. Please don't Google it because I don't believe that anymore. I went to a talk by Wisconsin Children's about a year and a half ago, and they were really talking about the patient's digital pathway. As we go through this conference, as we're thinking about where we're moving, I think our jobs are to figure out what are small pieces within the patient's digital pathway, how we fit that puzzle together so that it is a seamless experience for patients, because that's why we're here. We don't exist without patients. They're really our true north. At the end of the day, our job is to figure out how this grandma can hold her grandson up in the air and lead a happy and healthy life, however they define it, whatever their condition is. So as you're going through this conference this weekend, I encourage you to continue thinking about the patient, putting them at the forefront so that we as hospitals and vendors and partners and whoever is working in the healthcare system can figure out how we come together in that patient's digital pathway to ensure that we're meeting our patients' needs. With that, I'm going to say thank you for your time. Hope you enjoyed the talk, and I'll be here for some questions, and I'll also be doing some networking later.
Tori, thank you so much for your insights and your thoughts. And honestly, I think many of us from a day-to-day basis can kind of feel the challenge of these times and the loss and feel very overwhelmed. And the story of what your team has accomplished is just absolutely incredible and inspiring. And I'm not surprised they're rolling out the red carpet for your team because it's really incredible what you guys have pulled off.
Yeah, I feel like that was a little bit more of a joke, right? But it is a little bit how we're feeling internally, is that there's never been a spotlight on telehealth like there is right now. Yeah. And that is a good thing, but we're also under the microscope. So it's also a little bit of getting used to that internally as well.
Yeah. Well, we've had lots of great questions come in for you as you've spoken. We have time to take just a few. So first, as a children's hospital, you have a unique view into virtual care for pediatric cases. Can you talk at all a little bit about what considerations there are in using virtual tools for children? And a question came in around if there are specific kind of devices in the remote patient monitoring space that are being used for children.
Yeah, so I may surprise you a little bit here because I'm not even going to talk as much about the technology. It's how the technology needs to work within our existing processes and what needs to be met for patients. And what I mean by that is the consent to treat is a little bit different with patients. How does my chart work? This is a little bit different for pediatric patients because depending on the child's age, they have to be able to be connected with a parent, or it's done in person. How are our technologies really working on these pieces so that we can ensure that we're meeting those legal requirements for pediatrics is incredibly important.
Mm-hmm. Yeah, okay. So another question that's very top of mind to folks is really thinking about hospital administration and the costs that go along with scaling and investing in the virtual care resources, the telehealth resources. One question asks, how much does this cost? And another one really is, how do you get administrators to on board with the cost that it will take to invest in these services and to deal with their concerns about is the quality of care there? Can you deliver that quality of care? Can you talk to that?
Yeah, I'm going to talk a little bit about this. I'm going to answer your question, but not as directly. So as we're looking at softwares to roll out, we actually go through and we put a list together with our technical team of what do we need and what would be nice to have. And then we have them go through and do their own evaluation of technology. We're always putting out bids as well whenever we move to a new technology. But that was a big point with Microsoft Teams, is that the cost to rapidly scale with some of our other vendors was absolutely cost prohibitive. But when we had that enterprise license for Microsoft Teams, that's why we pivoted and we moved forward with Microsoft Teams. Now, I think there are some other pieces we have to think about as we're moving forward. We're working a lot, for instance, with Teladoc and now with TytoCare. And they have some of those built-in features that we don't just want, that we actually need. Like the consent to treat is built in, the waiting rooms are built in. So those are some of the things that we're thinking about as we're selecting those vendors, and that we're also thinking about that cost prohibitive aspect of the value.
Okay, all right, that makes sense. So finally, how people are interested in what metrics you're really looking at to define and rate the consumers, the patients' quality of their experience. So it looks like, you are following up and understanding how that experience works for people. Are you looking at outcomes or ease of use or the quality of that communication with their provider, the quality of the care they felt like they received? What metrics are you using to define your success for visits?
Yeah, I think overall we try to align with the division's existing metrics. But when we're talking about patient satisfaction and patient experience, you have to be so careful. You can't ask them 30 questions, right? So for us, we've really boiled this down, and it's a few things that are incredibly important to us. Ease of use. What was your experience like with the provider? Would you recommend this to someone else? What are your open-ended questions? These are the pieces that we're using, we're synthesizing, and we're actually sending them back to our patient and family relations team to be scored as well. And we're using those for quality improvement.
Okay. Well,
some other things that, Some other things that we're looking at, for instance, with our direct-to-consumer and minor illnesses and injuries, antibiotic prescribing via telehealth. This is huge for pediatrics. The other piece that we're looking at is, are we still sending the letters to the primary care physician? Because with pediatrics, that PCP home is so important, and making sure they're getting that communication as well. So I know it's not a lot of time. I'm happy to answer other questions later, but that's just a little bit there. Thank you.
Okay, great. Well, thank you so much for sharing your time and your insights with us today. We will try and get you those additional questions that came in from our attendees today, and hopefully you'll have a chance to join in on the networking discussions afterwards. Thank you so much, Tori, and we'll talk to you soon. We're going to switch over to our panelists now. So give us just a moment, and we'll bring our panelists into the discussion to continue this conversation. Thanks.
Our latest research shows that between Q1 2019 and Q1 2020, intention to purchase a smartwatch rose from 13% of U.S. broadband households to 20%. Over the past several years, we've seen innovations in technology that have ignited the imaginations of many, with consumer wellness devices increasingly encroaching into the medical space by monitoring an increasing number of vital signs. The most notable additions to date include high and low heart rate notifications, EKG detection of abnormal heart rhythms, and blood pressure monitoring. With an ongoing pandemic situation, the ability to track these metrics and be notified in the case of abnormalities may be extremely valuable to many. Tech giants in the consumer space are also beginning to make inroads into the medical market. COVID-19 has accelerated many emerging solutions in the healthcare space, especially use and familiarity of telehealth services. We anticipate increased use of medical devices in the short and near term, ultimately leading towards long-term increased usage. As consumers integrate connected devices and services ever more deeply into their lifestyle, they bring the same expectation and desire to their health and well-being. We anticipate more changes to come in 2020 as consumers adapt to being at home more, consider new ways to exercise as a result of limited gym time, and pay closer attention to medical issues. Thank you for joining us to learn more.
Okay, great. So we are back for our panel discussion, where we're continuing to talk about the market transformation of the connected health space and really the outlook for this space. I am joined by a great panel of industry experts. I'm first going to go ahead and ask each of them to introduce themselves and their companies, so we have a little context for where their perspectives are coming from, and then we'll dive right into the discussion. So first, let me welcome Dedi Gulad, who's the CEO and co-founder of TytoCare. Dedi, welcome. Great to see you.
Hi, great to be here. I lost. Okay. Do you hear me okay? I had some difficulties hearing you.
Yes, I can hear you great. Hopefully you can hear me as well now. We'd love to hear a little bit about TytoCare and about your role there.
Sure. So thank you, and great to be here. And Tyto provides a very unique solution for home examination and really making telehealth much more of a holistic approach with the medical, really replicating the medical service. Basically, we connect mass consumers to clinical groups and really allowing this interaction to be much more, again, holistic by allowing a full diagnosis at the home with a medical kit and with a complete interaction with a clinician, either synchronously or asynchronously. We work mainly with the health organization, both health plans and health system across the US and Europe. Nice to be here.
Hi, this is Carrie Holly, and I'd like to tell you a little bit about our company, United Health Group, which I think most of you have heard of, but as an organization, we're pretty energized about our opportunities to help people live healthier lives. United Health Group is comprised of two businesses, which many don't know, United Healthcare and Optum. And as we all know, the stress on the healthcare system is pretty intense, with chronic diseases accounting for 86% of the nation's healthcare costs. But as a healthcare company, our goal is to not only do health coverage, but to provide health care. And one of the ways we're transforming in that direction is the way we look at a person's health. And so we're doing a lot of different things, interactions across the healthcare system, from clinics to pharmacies to hospitals to home. And we put a lot of these puzzle pieces together. So we recognize that living healthier isn't just about treating disease, it's about social, culture, economic, emotional elements that all influence a person's health. So we're doing a lot to leverage advanced technology to make that possible. Again, my name's Carrie Holly. I'm a technology fellow, and my role is in the Optum Technology Group to help provide engineering and innovation to assist with many of these goals.
Wonderful. Thanks so much, Carrie, as well. Thank you for joining in this discussion. Next, we have Greg Lilligard, who's the Chief Operating Officer for A&D Medical. Greg, tell us a little bit about yourself and your company and your role there.
Yeah, good morning, and thanks for the opportunity to speak. So I'm the Chief Operating Officer with A&D Medical. We are one of the device manufacturers invited to participate today. We're actually the inventors of the original digital home blood pressure monitor. We are design, manufacture, produce, and sell our blood pressure monitors, weight scales, activity trackers, and other clinical devices. We offer things that are useful in the home, and we also offer products into physicians' offices and clinics. So we range from home use to clinical use. We had the good fortune of having a customer push us into connected health way early on. So we launched the first connected blood pressure monitor back quite some time ago, and it's always been a large portion of our portfolio. So we're just delighted to participate in a connected health discussion such as this. Part of our key tenets have always been making sure that all of our clinical devices are thoroughly clinically validated. And we've been doing this for 40 years. We're based out of Japan in a worldwide company and very happy to be here today. Once again, my name's Greg Lilligard.
Great, thanks, Greg, and glad to have the 40 plus years of experience that your organization is bringing to the discussion today, and your insights as well. We also have Rob Schneider, who's the Senior VP of Commercial Operations at Omron Healthcare. Hi, Rob. Tell us a little bit about Omron.
Hello. Sure. So I'm Rob Schneider, Senior Vice President of Commercial Operations for Omron Healthcare. I've been there for about 15 years or so. We are involved in bringing tools to market to help people take better care of themselves at home. In particular, we focus in on heart health, respiratory care, and non-pharmaceutical pain management. Heart health is our biggest area of focus. We are very big in the blood pressure monitoring space as well. We've been in it for decades now. We're the #1 doctor and pharmacist recommended home blood pressure monitor that's out there. And really what we focus in on is bringing tools like you see on the screen, whether it be ease of use in a more watch-like blood pressure monitor or adding EKG into the monitor. And then our newest launch just in July is VitalSight, which is our remote patient monitoring service. So that's certainly very relevant in today's world. So in general, all of these really focus in on our mission, which is going for zero, which is to eliminate heart attacks and strokes. And that really drives everything that we do at Omron. So I look forward to the discussion today. I think we have some very interesting topics to talk about.
Great. Thank you, Rob. And thank you all for being here today and for discussing this important topic. So before we get going, we're going to start off with a really big picture question about really what has been the most profound impact of COVID-19 in the past 6 months on the people that you serve and on your organization. Before we jump in as speakers, I'd like to ask the participants, the attendees here, to go ahead and jump over to the polling tab. So in the poll, we have the same question essentially for you. There are so many different angles and aspects of what COVID-19, has meant essentially to this market. Which of the ones we've listed, at least, have most impacted your business? And we'll see what our attendees feel has been most impactful in their business. But for you guys, again, there have been so many different angles, right, to what's happened in the past 6 months. I'm really interested to understand, what has been most impactful for your organization. What's the most profound change that you're seeing in the market right now? And let's go ahead and start with Rob.
Sure, Jennifer. I think, it's been a crazy 6 months for sure, based on everything that we've seen. And it was interesting because when the pandemic really first hit in the U.S., a lot of the news is a respiratory-based illness. And, it was kind of spreading across the world. It showed up in the United States, February and March. And then initially we saw in our business kind of a drop as things started to shut down. Stores were shutting down. People's jobs were ending, being impacted and what have you. But then it immediately started to shoot back up. And I think the biggest change that I've seen is just the consumer interest in their own health and monitoring at home across a whole wide variety of areas. For us, in the home blood pressure monitoring area in particular, it shot way up as more articles started to come out about the connections with COVID-19 and heart issues, both for people who are very sick with it as well as those who are recovering afterwards. And some of the more recent news is just fueling that even more. So really what we've seen is demand go up considerably. over the last 6 months, and it's staying there. And I think it's just a renewed interest for people. They're scared. I think COVID-19 was a big wake-up call, and it really is pushing people to do the things they need to be doing at home, which have been important, and they've always been important. But I think it just raises the awareness level right now. So that's a huge one, and I think just the adoption of people being flexible to change instantly. Going to their doctor virtual instead of in person, but our devices are all very helpful for providing the data to the doctor to be able to help. So I think we've seen a big change in the consumer behavior and just interest level around monitoring, and it's not showing any signs of slowing down right now.
Yeah, that's interesting, especially when you mentioned, there possibly being cardiac and heart health issues related to the virus and how that's really impacted your business, even though we think of it as a respiratory illness first. Well, Carrie, let me bring you in. Can you talk about how COVID has really impacted your business and what really maybe the most profound changes are that you're seeing? There's a lot of different tentacles to Optum, right?
Yes.
I imagine you see a lot of different impacts across the various parts of the ecosystem that you touch.
Yeah, it's a great question, and absolutely right that we see a lot of impacts across our various business models. One of the most obvious changes is work at home, and we've done a lot in terms of increasing that capability to support our global enterprise, whether that's virtual VPNs, help desk support, redeploying staff, putting more equipment into people's home, laptops, headsets, et cetera. As a payer, as an insurance company, as a healthcare services company, we've seen a reduction in the number of claims because of optional medical care being deferred, maybe things like physical exams. The pandemic has changed how outpatient care is delivered. That's been a big one. We've already talked about that in the talks already today. But we've also, we have a pharmacy services, and we do a lot of prescription services. That demand has increased because our business is largely delivery through mail. Tools have expanded access to testing, medical care, medication, and of course, telehealth services and virtual care is expanding. So our digital platforms have improved to create symptom checkers. We've partnered with companies like Microsoft, but we've got symptom checkers to help members rapidly access the risk for COVID-19, access to data, modeling capabilities, automated reporting, dashboards, analytics to inform and influence actions have been on steroids. We're enhancing something called FluCast, which is a tool we built to help us predict and track flu outbreaks. We're doing now the same thing with COVID-19. We've had tremendous collaboration across our business units to provide data and information assets. That's something we hadn't previously seen. We've seen that we can actually deliver innovation faster. So we've used advanced analytics to identify high-risk patients across Medicare and Medicaid. It's enabled our care teams to focus on those populations. We've developed guidance for employees around work at home because security now is a big deal. Practices and awareness to prevent phishing schemes associated with COVID-19 as we have more people working at home. So we've done a lot of security and privacy in our Optum Care business to cover remote work and telemedicine. We've done more partnerships with suppliers to discuss security risk management. We've had and built digital response teams to access and govern telemed solutions nationwide. We've activated over 44,000 clinicians to onboard them to our telemedicine platforms. We've done a lot with click-to-chat functionality to reduce call burdens, whether it's related to prior authorization, benefits inquiries, whatever. And we've expanded access to telehealth services and for digital behavior health as well. So that's just a quick summary, but we've got a lot going on.
Yeah, there's an incredible amount to pull from there. We're going to talk a little bit about new use cases that have arisen a little bit later in our discussion. So I'm definitely going to be coming back to you to pull on some of those because you guys are clearly innovating in a lot of different areas. But next, let me ask Duddy the same question. So, you guys are interesting in that you have both the virtual consultation service, you've got the peripherals, both consumer and in the facility setting. What is your perspective really on, again, from a big picture perspective of really how this has impacted your organization?
speakers before about consumer awareness and the demand increasing. Taito has tripled our manufacturing capabilities only in the last 6 months and continue to grow very rapidly. I would say we are different in a way that our solution really connects the service side from the provider market, health system, physician group, and so forth to their consumers. So we really saw a big shift. The trend was already there pre-COVID, but with COVID, when hospitals really shut down on unnecessary visits and shifted their service modality to telehealth, this is now becoming a necessity. So unlike pre-COVID, when more of the advanced one did a real deep service level with the ability to really diagnose people from remote beyond the chatting or video conferencing, now we see health organization really making this their primary way of conducting service, primary care service and urgent care. And in this case, they really need to enhance the capability. So not only, again, those phone calls or video chats, you have to do much more. We just heard previously before our session, Cincinnati Children's speaking about their shift and many others. Taito is working with 130 health organizations across the country and many more outside of the US. And really, this became like a real boom for us in terms of the need to really shift the way they conduct business. So this is one aspect that we see, and specifically COVID, because it's a multi-organ issue, both respiratory, temperature, throat issues, and so forth. Taito, as an all-in-one connected tool with the platform, really allows this to really help health organization both keeping patients away from the hospital when they don't need to be there, but also to help in quarantine and monitor people who are under either risk or already diagnosed. So we did about 50,000 patients of COVID only in the last 3 months by helping hospitals, both inpatient people that were already diagnosed and being kept either at home or in a hospital, as well as people that are only starting to show symptoms and really needs this monitoring. So again, across the board, when you connect the actual service modality with the consumer engagement, the ability for them to do their work on their own, I think this is also a big shift that we are seeing in the last few months.
Yeah, I think it's really interesting. I know that we've talked before about the use of Taito Care devices by consumers in the home, but then also, let's say, by a mobile unit, if you will, outside of the facility to check temperatures, right, and maybe a drive-through testing area, or maybe in the facility where you can be using a remote health tool to keep providers, having space and protecting them, but actually doing virtual care within the facility setting too, which is really interesting. So let's go ahead and bring Greg to the conversation. Same question to you, and then I'll talk here about what our polling results are. Really, what have you seen as being the most profound impact over the past 6 months on your business?
Earlier, Jennifer, and then, Tori, Didi, Kiri have mentioned too, just the pandemic as an accelerant to the adoption of telehealth meant that early on, demand for our products exploded. We had a lot of customers who were coming to us looking for more connected devices than they had purchased in the past, and a lot of new healthcare entities coming to us to add telehealth into their portfolio. With an operations background, I had a different struggle, because not only did I have this growing demand, one of our 4 major production facilities and maybe about 40% of our vendors in some way, shape, or form are tied to Chinese sources. So simultaneously as our demand was going up, our ability to produce was going down. So similar to Rob's comment, that contributed to some severe craziness at the start, but we've navigated through this. And, the good thing to know is that this is going to be the impetus that people have used to just adopt telehealth, not just as a momentary way to address the pandemic, but as a permanent shift in how they're going to provide care.
Mhm, mhm. Well, what's interesting is when we look at the polling results here, there's a big spread over what people think are the trends that are from COVID-19 that are really impacting their business, and one that's remarkably low, which will be interesting. So about 19% of folks said that loosening regulations and expanding reimbursement is most impactful. About 22% said restricted in-person care that's driving that reliance on virtual care has most impacted their business. About 1 in 4 say societal and lifestyle changes due to social distancing. So really more that kind of change in consumer behaviors, change in consumer attitudes related to connected health, 30%. Very few have found that changing physician attitudes related to connected health have really impacted their business. So that's pretty interesting. Let me speak for that first answer first, because all of you come from the technology side, right? You're offering technology platform services, devices, and all of you mentioned that you obviously had growing, vibrant businesses even before this, and the technology to enable consumer empowering, connected health and wellness monitoring, to connect the facility to home, has really been ready for a while, but it's that sustainable business model question that has really proven to be more difficult. So I'd love to understand, what this new landscape means for the business case for connected health solutions. How are you seeing that change? And maybe we can start off with Greg.
Yeah, so certainly we've seen just an explosion in demand, and we have more entities looking for how can they secure a reliable supply of connected devices. And part of what we're also exploring is how do we assist others? So as the device manufacturer, we've got an established history, but what can we do to provide people with software and the other tools that they need to, develop their own programs for a virtual visit, and supporting even small practices on their initial steps down a telehealth journey. I think that's going to be a big part of our future and a big driver for us as we go forward.
Yeah, I can imagine providing that sort of real partnership experience to health systems, to care providers, to practices. I imagine many of our attendees who are more on the vendor side were probably taking notes as Tori was speaking and saying, these are our pain points, help us solve them, right?
Yes.
And really bringing that from a service perspective and a service mindset.
Yeah, it's all about, I thought Terry mentioned it well. It's you don't need separate metrics. You need to say, how can we do this without causing pain to patients and providers? How can we fit into existing models and just provide a seamless experience that's different from the in-hospital experience, but achieves everything that people want?
Mm-hmm. Mm-hmm. Absolutely. Now, let me bring Debbie back into the discussion here, really on this decision of business case, right? So have you seen, whether it be reimbursement models or different ways that people are thinking about opportunities in the connected health space now, where the business case really shifts coming out of this?
Sure. I think, again, I think the main metrics at the end of the day, all health organizations, when they implement technology like ours, like the other panelists, is really around the ROI and how can they really see the cost reduction in their service, or ability to approach more patients in a in a better way, I would say. So basically, what we've seen is that utilization was a key driver. Even pre-COVID, one of our key elements was really increasing utilization. When we are providing a remote care with our platform and technology, we really see a much higher engagement and a much higher utilization, which equals at the end of the day to ROI. When more people are using telehealth, the more cost reduction exists. Certainly, a big shift and a big area to push the commercialization side and the business modality is around reimbursement. Both, CMS is loosening some of their regulatory burden. Providers and insurers who take risk are willing to do more around telehealth and really substitute face-to-face with an online interaction and pay in a similar way, and that drives provider to do more. So those are really a part of the elements that really help improving the business modality. And again, I think at the end of the day, if you manage to attract, because it's a shift in behavior at the end of the day. Telehealth existed for 20 years prior COVID. A lot of tools were there. Utilization was very, very low. We have to admit, it was 3, 4, 5% maybe. Again, part of our, I think, innovation and the way that we invested a lot into the product and the AI is really to create this engagement and increasing utilization. Now COVID is helping a lot, which is great, and I think this will be a key driver for continuing the business modalities.
Yeah. So, Duddy, beyond the sort of increased utilization, obviously with reimbursement opening up on the sort of healthcare side, maybe originally we saw a lot more direct-to-consumer business, whether it be for telehealth services or those in the device space selling directly at retail and pharmacies, right? Do you expect companies that maybe have dual business models or have been looking more to the direct-to-consumer market, maybe shifting their attention to B2B to the health systems because reimbursement is opening up?
Yeah, I certainly see that. I think again, this is also the right way to go. This was our approach from the get-go. Although it's a consumer product and you can go and we are selling D2C, the majority of our business, I would say 90%, is in a B2B or B2B2C modality, because once you are, consumers are not looking just for devices to track themselves. Some of them are on the wellness side, which is great. But when you talk about real serious medical service, consumers want to know that they are connected to the best-in-class clinical group, that they can really get the best service out there. And we are enabling that, all of those tools that we are discussing right now. So you cannot really have a sustainable business without the missing element or the big part of the equation, which is the provider groups and the health plans. All the health plans today, we have Optum on the line, but I know other payers that we work with are providing services on their own, Optum for certainly. So this is the way to go, and I believe most of the D2C players will have to also get into that business as well.
Mm-hmm. Well, let me go to you, Rob, for your perspective on that question. I'm certainly having a direct-to-consumer business angle, right? What are your perspectives on that B2C versus B2B business models, hybrid business models? Has the business case shifted as reimbursement has opened up?
Yeah, I think I would agree with what Duddy just said in regards to shifting needs to occur because the channels are shifting. It has been interesting because a lot of us in this panel, as well as at this overall meeting, have been involved in telehealth for many, many years. And it's always been a battle. There's always been barriers to get over. And now with some of the recent, the CARES Act, COVID-19 in general has suddenly thrust it into the spotlight. As Corey was even mentioning earlier, it's like there's a whole different mindset in terms of listening to different ways of doing things. So I think that falls right into the B2B approach. Now, that being said, I think B2C is going to continue to be a strong component as well, because the reality is, at least in the space that we play in hypertension, there's 103 million people in the United States that have hypertension that really should be monitoring their blood pressure. And some of those have the very basic needs to some that are maybe a little bit more integrated in with a variety of other monitoring that they're doing. So I think it's going to be a balance and a combination. And I think as things continue to become more integrated in different solutions, those worlds will start to blend a little bit together. I mean, just as an example for us, I mentioned earlier VitalSight. It's a new remote patient monitoring service that we just launched. So we're doing some very interesting work with Mount Sinai in New York, on this. It's very much a hypertension program meant to monitor people remotely. It feeds back into the electronic medical record system. There's a doctor dashboard, all these kinds of things to really help monitor at a different level for people. So I think that's going to be a model that's going to continue to take off, and the interest level in it over the last few months has grown tremendously because of just the need to be more virtual and everything else. That being said, though, I still think there's going to be plenty of people that need to go to their local pharmacy under their doctor's guidance to get a blood pressure monitor and start monitoring. It's really about how the data gets back to the doctor. It's valid data, it's credible data that the doctor can make the appropriate decisions for that patient's care, whether that's through a remote platform or whether that's just through some of the connectivity means that we have today. I think it's going to be a combination.
Mm-hmm. Mm-hmm. Great. Well, let me move on a little bit to use cases and how many new and different use cases are really coming out of this for connected health. I'm hearing about certainly triaging care, first and foremost at home, diagnostics at home, about using connected health and communications tools to connect patients who are in the facility with their family who's outside of the facility. There's so many more much more strict regulations and policies about who can visit and what visitors can come into the facility. That may be something that sticks long term, right? And so enabling that communications piece to the family outside the home. I'm also hearing the term telovigilance, right? Where not just using connected health solutions to treat acutely or ongoing, but actually proactively monitoring your health to detect if there is that temperature rise. And again, we're seeing this more maybe on the business, corporate, employer space and the schools, right? Monitoring our health proactively to detect illness. So I'd love to come back to Carrie. You mentioned a lot of different things that Optum's working on, right? A lot of different innovative kind of places that you have your eye right now. So what new use cases can you talk to us and flesh that out a little bit more that you're seeing as being, real opportunities or real needs that connected health technologies can solve?
That's a great question. And let me just start by saying some specific technologies are actually informing and influencing our decision-making here, specifically artificial intelligence, the Internet of Things, ambient computing. But the big use case I would say that we see really is about healthcare at home. And we see ambient technologies, which include smart speakers and sensors, cameras, all of these smart home products. And what we mean by ambient in this context is computing that is embedded in our daily life, in a patient's daily life. It's invisible. It disappears into their environment. We see these smart technologies fundamentally improving the way we deliver healthcare in the home. We think this market's going to be a convenience for a consumer. We're going to tap into consumer-centric approaches, but we also think that this is a way to serve our elderly, to serve more people that have been disenfranchised or not have access to care. So better care for seniors, continuous maternity, postnatal care for mother and children, post-acute care, continuous monitoring of chronic conditions, support for clinical trial participations at the home, early identification, risk prediction of the onset of chronic disease, the stuff we do with machine learning, early management to prevent patients transitioning into episodic or advanced state condition. So we think of this notion of home care is based on our ability to do more with our virtual, to do more with telemedicine, to do more with intense personalization. But technology becomes a big enabler. But the key there is for the technology, as I said, to be invisible, so that I, as a consumer, I'm not sensitized to these devices. They simply are there, and I simply, like I do today with other things, I just use them. I use them through the voice modality. I use them through sight, whether they sense that I've fallen in the home and do alerts. But that's probably the big use case that we see.
Yeah, that's really interesting to think through. There's so many use cases to be built off of that ambient technology, and especially when it gets to that place where so much of it is automated for the user and it's not the user having to do setup and having to do configuration and having to make sure all of the technologies work. There's a real user element and learning curve to that. Seems like maybe there's a big gap in how we get to from one place to the other. Do you have any thoughts on that?
Well, when you think about security in a home, I don't know if many people think about this way, but think about all the devices that some people put into their homes to provide safety. But those devices, to a large extent, are invisible. But I think that you're spot on that, the key here is to look at the journey from both the lens of the provider, the clinicians, as well as the consumer. But I do think with the explosion of these devices to detect a variety of disease states, as well as the ability to predict behavior and to influence behavior, there's a huge opportunity for us to make a difference in consumer-based home healthcare.
Carrie, let me also ask, a lot of what you talked about, is pulling on different threads of data, right? In order to be able to do those analytics and to make new diagnostics, right? Right now, so much of the data that we have access to is very, very siloed, very fragmented. Can you talk about what work you see happening or what needs to happen for, better integration of that data, or, what players in the ecosystem are best positioned to provide that and maybe aggregate some of that?
That's a great question. So this is probably multifaceted. I think that we are going to see more data being owned by patients, by the lives that we serve. So in one sense, we're going to see people like you and I allow more people to have access to our data. That's going to be one solution. I think there's got to be more interoperability. We all know that in terms of how we both share data. Technologies like blockchain are going to help some of the competition. It's going to sort of lower the intensity of competition and allow more cooperation in terms of sharing. But I do think that, and regulations are going to play a role here as well. But I also think that all of the big ecosystem players are going to need to work more together. And then, the guys with big footprints are going to need to do more to connect their data and to make it such that it's actually improving lives. And that's what we're trying to do at United Health Group.
Okay, great. Thanks. Great insights there. Let me bring Greg back in to talk again about use cases. So, from your point of view, what new use cases do you see really growing out of this experience? Maybe use cases that now have new priority, whereas others don't perhaps seem as relevant.
Well, I certainly think the telavigilance is a very interesting one, right? You're going to have all sorts of larger organizations that are very concerned with making sure that their employees, their students, anyone coming into their facility has passed some basic health screening. And how do you do that? And how do you do that effectively in the home? That's where, I'll second what Carrie was saying. You really want to have a way to leverage the smart devices and the infrastructure in the home as much as possible to just make this seamless. One other thing I'll add to the previous discussion as well. So you've got the interoperability challenges and the breaking down of barriers to make the data less siloed. But then it becomes just a huge, big data problem, right? You have all this potentially useful information, but it's a massive amount of data. And that's where artificial intelligence and other approaches are going to be critical to pick through the forest of individual bits and pieces of data to try to find, hey, here's an important trend. I saw a very interesting presentation on how do you use the home security capabilities to turn it around and say, if it's an elderly resident of the home, are they at risk? Are there signs of dementia? Are there signs of them not following their normal routine? And it makes sense because the sensors give you the sort of information you want. It's just a matter of, can we develop the tools to pull that out in a sophisticated way and in a meaningful way, to come to these conclusions.
Yeah, absolutely. Now, I'm going to tee up our participants again for our second polling question. So if you haven't already visited, that second polling question is asking what are the biggest challenges to solve for the next generation of connected health solutions? And while we wait for people to weigh in on that polling question, back to the speakers, there is so much uncertainty in this market, right? Will these regulatory and reimbursement changes stick? What consumer behaviors that have changed are temporary, which will go back to normal, which will change forever? As a company in this space, how do you plan for that in the midst of all this uncertainty, right? How do you think about what your next steps are? So I'd love to start with Rob here, if you can talk to us about, what you guys are doing as an organization as you think about this uncertain market.
Sure. I think a lot of the points just made about interoperability and working together, that's all what's going to come to fruition here, I think. And it's been interesting because, like I mentioned before, a lot of us have worked in this field for a number of years, and there's been lots of barriers. I think just this year with a pandemic in place, it's opened up the door with reimbursement. Even before that, with the CPT code changes for remote monitoring, et cetera, it started to incentivize the right areas to want to move down this path. And then really, COVID-19 was just kind of the fuel on the fire that really started to drive things where, now the door is wide open in terms of how to go about things. So, for us, our mission has always been about educating people on the importance of heart health and how to better manage it yourself at home with your doctor. And it's very much evolved into getting information of what you're doing in your home or in your life, monitoring and getting that information to your doctor so they can make the right decisions with you for your life and your health. So that hasn't really changed. I hope that the reimbursement obviously sticks around. And I think the longer it does, the more motivation and incentivization it drives for everybody right now to be able to continue on that path. But I think the longer we can do that, then it becomes more personal habits for people. And that is what I think will stick in the long haul, which is the most important at the end of the day.
Yeah. So interestingly, the results of our poll here, what are the biggest challenges to solve for the next generation of connected health solutions? And we gave them 5 options. Obviously, there's a long tail of perhaps other, but the biggest challenge that rose to the top, 38% said, was siloed data and a lack of integrated approach, followed by uncertain regulatory and reimbursement policies. Fewer were concerned about state licensure issues. We heard Tori talk a little bit about that, about licensing of providers across state lines, or training end users on how to properly use connected health solutions in the home. When you think about patient compliance with discharge instructions and compliance with their care regimen and compliance with the prescriptions, will they be compliant with how you actually use devices is another concern. Not as high of a concern, though, about that as siloed data and a lack of an integrated approach. So let me come back to Dedi there. Is that surprising to you? Not surprising at all. And do you have any comments on what kind of needs to happen to bring all of this data that's existing in these different pockets together to have actual, valuable use cases where, health outcomes can be improved and more people can reach?
Sure, I think first of all, this is the mention about the gigantic amount of data, this big data problem. It is meaningful. At the end of the day, when we work specifically title, or when we work with health organization, we keep it very important to streamline the data into their EHR. So we work seamlessly today with Epic, with other telehealth vendors, with the Teladoc, American Well, and MD Live and others, and very soon with Cerner and others. So this is a big element for us. At the end of the day, the data, if it comes from the home, from consumer, belongs to the consumer, and we get their consent, obviously under all the HIPAA requirement and GDPR in Europe. And we will link that to the backend systems. But I think beyond the data itself, people mentioned earlier, and this is a critical element, what do you do with this data? So we, again, in Title, invest a lot in machine learning to learn from that. Because we collect data from imaging, both throat and ear and skin, as well as auscultation of heart, lung, stomach, and basic vital signs. We have a very unique set of information about the patient and their background symptoms, and all of that is gathering to the our solution. So the health organization, first of all, have access to it, both in terms of history, and physicians can see a history and trend of patient over time. But we also start to build more and more about comparing data from that specific patient based on baseline and showing trends and changes and alerts over time. So it is a decision support with machine learning that helps physician to treat patient better, to get the alerts. People mentioned earlier RPA modalities and so forth, but also to help consumers better understand about their condition. So again, bottom line, it has to be integrated to the EHR. It doesn't have to reside there physically. You know, you can think about PACS systems, you know, all the imaging system in the world that exists for many, many years are different, are separated in terms of repository, but are deeply linked with the EHR. So I see our data in a similar way has to be connected to the EHR. I would just add one more comment about the use cases that you mentioned earlier. We're already seeing, again, in title, some very interesting shift. We just did a very successful implementation with the University of Miami about remote vigilance and students that are coming back to school. We now have thousands of students that are being monitored on an ongoing basis in the University of Miami, and they see it as a way for them to conduct the business back again and bring those students back to the university for the new year and so forth. So again, we're starting to see this shift happening.
Yeah, absolutely. Well, so we, as we've been talking, we've gotten quite a few questions from our attendees here. So I want to work through a few of these and get the temperature from the speakers here. So one, of course, of the most important questions that we need to address is how do we address the disparity between the haves and have-nots in telehealth, right? So talking about connected health, there's a precision of connectivity. Parks Associates estimates that about 86% of all U.S. broadband households of all households in the United States, whether that be traditional fixed broadband, internet, high-speed internet in the home, or at least mobile broadband access. There are a growing number of households that are mobile only. They have a smartphone or a tablet or perhaps a wireless dongle in their home.
Oh, wait, you're out. Sorry, it like cut you out.
Hey guys, sorry about that little technical snub there. So I dropped back off, but I think we're back. Can you hear me okay?
Yes, we can.
Yes, I can hear you.
Okay. Well, so I was just essentially talking about haves and have-nots, and essentially that Parks estimates that about 86% of all households in the U.S. do have some form of connectivity, wireless only, or traditional fixed broadband internet. We know that a lot of the internet service providers and the telcos have done a lot during the pandemic to actually make their services more accessible, but still there's a lot of people that are not even necessarily in the addressable market because they don't have reliable connectivity in their home, or just they're underserved populations generally. They may not be very comfortable with technology. How do you think in your organizations about making sure that what you're offering can reach the people often who need these types of services the most? And perhaps we can start with Carrie there.
Yeah, I think that's a great question. I think that one of the things we are looking to do and continue to try to do more of is look at the social economic aspects, and we all know that has a huge effect on patients' health. So I think one of the actions is, for example, we've been donating funds to create more housing, which is a big factor, obviously. For one to be able to do telehealth at home, you need a home. So I think that we'll need more companies, ourselves included, doing more in that space. That will need to address the, some of the social economic aspects that are preventing, preventive healthcare service. So I think that's one. I think the data that I see says that although broadband and internet is constrained in a lot of households, at the same time, it seems increasingly that most consumers, even those that are just, at maybe poverty level, still have cell phones. So mobile devices continues to be an avenue to reach some populations that are underserved. So I think ensuring that we have services like that are important. I think thirdly, we can still do, I think the person-to-person contact, even with COVID-19, still has to occur in terms of nurse visits and doing things like that. So financial guidance, prescription adherence, doing infusions. There's a lot of things I think we can do that are going to be hybrid. So I think that it is going to require, I use an age-old adage of, it takes a village, but it's going to require a lot of investment, a lot of social investment in both infrastructure and helping these disparate groups rise so that they have access to the services that telehealth, telemedicine, but I also think our continual focus on precision medicine as we advance that's going to play a huge role.
Yeah, thank you for those thoughts. There's so much we can discuss on that point alone, right? And what could be done to make sure that these tools are being accessed by as many people across the variety of our population as possible. We've got a lot of questions to get to, so let me move on to Brian. Can you hear the next question? That one there, the one before it, actually. So for all panelists, when thinking of full spectrum integration, so big data access and innovation, to what degree are you concerned that Apple, Amazon, Microsoft, and Google have the ability to enter the space? Are you concerned about their entry, or is there, there's a lot that the tech giants also bring with them. There's also a question when they come, will we be looking at, how do you think about the value of sort of closed, proprietary, let's say health monitoring solutions where, the solution is designed all together to work together, sometimes for a very specific use case, versus a more open approach where you are able to leverage, big tech with deep daily consumer engagement and touch to a lot of different data points. I don't know if anybody wants to chime in here. Perhaps Rob, do you have some thoughts on this question here?
Sure. I'll offer just a couple of quick thoughts. One is, I think it's good for companies like that to get in because of the interoperability that we talked about. I think the ability is there to connect data and bring it together in ways that's meaningful for the individual, for their doctor, for their caretakers, whomever it may be. So I think that's important. I think another part, though, that's along the lines of the business that we're in, and Greg mentioned it earlier as well, clinical validation is really important, depending on which aspect you're looking at. So for us, both of our businesses are very heavy around hypertension, and clinical validation is very important. So I do worry about some devices coming to market that maybe they're not FDA cleared, they're not clinically validated, and are they providing the right data that's going to be used in some kind of a clinical decision? So I think that's an important area to be very considerate of. And I think you'll see in the market, lots of businesses, companies will kind of bring their strength to the forefront, and then it's a matter of how you bring those together. And I think that's the role the bigger companies can play, but there is a watch out on the clinical element of it.
Yeah, thanks, Rob. And I think we actually saw Kerry also kind of raising his hand to jump in on this question as well. So please go ahead and share your thoughts.
Yeah, definitely. I think that the opportunity that we see with the big tech companies is a positive. I think it causes us all to rise. I think that we will see some of those companies, which we already see today, that we will partner with them. For example, we know that Microsoft and Google, just two examples of many, have huge infrastructures to support this concept of deep learning and artificial intelligence. So we're going to need to partner with them because of the unique expertise they bring to the table. So we're going to have these partnerships. In some cases, we're going to see competing products. They're going to develop products that are going to make us build better products. So I think that competition is good. We see that with clinical coding. We see that with ambient healthcare. So I think that our company, I know, is well aware of the what we can consider a threat, or we can look at it on the other side as an opportunity for us to get better at what we do, and in many cases to partner. So I think it's both.
Really interesting. And I think we do actually see that from the consumer side as well. So those in the consumer technology space, and I know, A&D and Taito and Omron in particular have devices, right, that are consumer facing, have a different experience, and the tech giants as well, building solution for consumers. And there is a certain level of expectation about what that user experience is like that is very, very different than perhaps in the healthcare space that doesn't have that same pedigree of designing consumer first solutions. So I think that's a really great point about perhaps raising the level, raising the bar for everybody. So with that, we are coming to time. We have lots of great questions here. One that maybe we'll get into on the provider networking discussion was about, with telehealth taking more share of the overall pie, when you think about volume, what does that mean for resources for the rest of, let's say, a health system? Really interesting question there. We are going to move to our breakout networking discussions. You can access them straight through the Swap Card platform. There's a place that you can link through. They're essentially Zoom chats to our networking discussions. It can be a little hard to find them. So our team has posted links directly to those networking discussions in the chat bar to the right. So please join us there. We'll continue this conversation for about another half hour. Then we're back here at 1 o'clock, where we will be taking a deep dive really into telehealth and remote patient monitoring specifically, with more research from Parks, another visionary insight talk, as well as another panel discussion, and then followed by networking discussions. So thank you very much to Beckler, who's our break sponsor, as we move into these networking discussions for about the next half